You have previously completed an orientation to Behavior Support Plans or BSPs, which are the most formal type of behavior support program. As you may recall, during that presentation we mentioned that there is a different type of behavior support programming, which we refer to as Behavior Support Guidelines or BSGs. BSGs are designed to provide an appropriate and less restrictive level of care to the individuals who do not meet the more intensive support needs of a full BSP. The purpose of this presentation is to provide an overview of BSGs. During this presentation, we will look at the similarities and differences between BSPs and BSGs in terms of format and content. We will provide a walkthrough of the type of documentation that will be used for BSGs, and we will discuss some types of habilitation programs such as sleep tracking or communication, which might be associated with an individual's BSG. At the conclusion of this program, there will be a short quiz to check your understanding of this training material. Let's look at the criteria for a Behavior Support Guideline or BSG. The purpose of the BSG is to provide guidance to staff in responding to problematic behaviors and/or mental health indicators for individuals for whom the IDT agrees meet most or all of the following criteria. For problematic behaviors that have been identified, we see that they are low in number, that is, there is only one target behavior or a small number of target behaviors that do not create a stigma, preclude access to the community, or affect learning or daily routine. Low in frequency, that is, the behaviors do not occur very often during each reporting period. Low in intensity, that is, the behavior of concern usually causes minimal risk to individual, others, and/or property. And for individuals supported with a BSG, we may see that psychotropic medications aren't prescribed at all, may be prescribed to treat a neurological condition such as a seizure or neurocognitive disorder, or may be prescribed for a psychiatric condition that requires a stable level of psychotropic medication. Unlike the potential for frequent changes in psychotropic medication we reviewed when looking at BSP criteria, individuals supported with BSGs are maintained at the lowest therapeutic dose of psychotropic medication when it is prescribed for mental health purposes. Another consideration for behavior support guidelines is that the identified problematic behavior or behaviors can usually be prevented, responded to, and decreased by the use of strategies, methods, or services that are already available or in place. These can include general antecedent or preventative interventions, which refers to things like environmental engineering, such as making sure that behavioral triggers are minimized, or providing non-contingent attention to an individual. Habilitation plans that increase appropriate skills that would further decrease the frequency or intensity of the target behaviors, and provision of other clinical supports such as speech therapy, occupational therapy, or individual or group psychotherapy, to name a few examples, which may assist to decrease the target behaviors. One other consideration is that because the identified problematic behaviors are low in frequency, intensity, or number, the behaviors or mental health indicators can be adequately tracked by shift rather than the more frequent hourly documentation, as is the case with behavior support plans. Let's now take a look at some specific differences between a behavior support plan, the BSP, and behavior support guideline, the BSG. One important difference, as we saw before, will be the type of information that is tracked and collected. With the BSP, we collect data on one or more target identified behaviors, one or more replacement behaviors, one or more mental health indicators, and sleep. With the BSG, we will be tracking mental health indicators and/or identified behaviors of concern as may be appropriate for the particular individual. We'll talk more about sleep and replacement behaviors a little later when we discuss programs that might be associated with BSGs. The next important difference between a BSP and a BSG will be the way in which data are collected. As we discussed during the BSP training presentation, most BSPs continue to use the paper daily data collection sheet located in each individual's DDB. However, data for BSGs are already collected electronically using TheraP in the ISP program format that is used for habilitation programs. The final important difference, as was mentioned before, is the frequency with which data are collected between the two types of behavior support programs. BSP data will continue to be collected on an hourly interval basis. BSG documentation, on the other hand, will occur only once per shift. Here's one more look at the way BSPs and BSGs compare on these three important points. Because BSGs are in an electronic format, they will in many ways resemble other habilitation programs for which you will collect data in TheraP. You might notice that much of the information you will see in a BSG program is quite similar to the information contained in a BSP. Let's walk through the various sections of the BSG program. We won't spend a lot of time on the first few sections, but we'd like to briefly familiarize you with them. The very top of the BSG gives you the name of the program, the status, as well as who approved and entered the program. You'll also be able to see if there have been any updates. The program description section gives you the name of the individual, where they live, that's the provider program, the program name, the date the program was created, how often documentation is entered, and so on. The scoring details just gives you what type of data you will be entering. In the case of BSGs, all entries will be yes/no entries. On a BSG, the questions you will answer when you enter your data are listed as a task. Each task is divided into parts. Each task has a header line that tells you about the task you are completing. The first part tells you what shift. The second part tells you about the task, that is a behavior concern, and the third part names the behavior of concern. The next line will ask the question for the task, then an instructions section will follow. Finally, there is a definition section that defines the behavior or behaviors of concern. And again, we'll talk more about specifically entering data in upcoming slides. The number of tasks you will see on a BSG for each shift will vary depending on the needs of the individual for whom the BSG was created. That is, for each shift, you may be entering data for 1, 2, 3, or 4 behaviors of concern or mental health indicators. Let's spend a little bit more time on teaching methods, which is the next section of the BSG. The information in this section is the same type of information we saw during Part 1 of the Behavior Support Plan training. Each of the teaching methods covers a section of the BSG. As we discuss teaching methods, you will notice that they are numbered as Teaching Method 1, Teaching Method 2, and so on. The teaching method numbers you will see in this presentation will generally be the same on all BSGs. However, you may see some slight numbering differences on some BSGs. In Teaching Method 1, you will generally find medical and health information, including any pertinent psychiatric or medical diagnoses. Teaching Method 2 will generally contain definitions of the behaviors of concern. You may also find definition of precursors or mental health indicators here. Teaching Method 3 will generally contain a list of setting events for the individual. Remember that setting events are things that increase the likelihood that a target behavior will occur. Teaching Method 4 will generally be a list of specific antecedent interventions. Remember that antecedents are events, people, or things that immediately precede problem behavior. So this is basically a list of specific things you can do to prevent problem behaviors from occurring with this particular individual. Also remember the general document called Interventions to Prevent Problem Behavior, which we discussed during the BSP training presentation. Remember that a copy of this document should be available in each staff office, and it contains a lot of good ideas for working with a lot of individuals in many situations. While this document is not an official part of any individual behavior plan, it is a good resource to be aware of and familiar with. Teaching Method 5 will generally contain a list of things to do when precursors or behaviors of concern happen. Teaching Method 6 will contain a list of things to do when the individual engages in positive behavior. Teaching Method 7 outlines data collection procedures. We'll walk through the specifics of data collection on upcoming slides. The final teaching method will list any other programs that are associated with the BSG. Some examples are habilitation plans that may be used as a replacement behavior, other ISP programs that are tracking behaviors, and ISP programs for sleep tracking. Also, here is an example where the teaching method number doesn't exactly line up because of additional information added to the BSG. So here it is teaching method 9, but with most BSGs you might see this as teaching method 8. At the bottom of the BSG program, you will see the Files and Images section. This section contains other documents that are associated with the BSG. In our example, there is a document specific to the individual for behaviors that are not tracked as part of the BSG. Finally, a step-by-step guide with information similar to that contained in this presentation is available on all BSGs. Any documents attached here are clickable links to allow you to open the files and review them, and also print them if you would like to do so. Also, at the very bottom, you have a link that will allow you to display the entire BSG program in a PDF format that can be printed out. A printed copy of BSG programs should also be available in each individual's daily documentation book. Before we move on to documentation methods, let's take a few minutes to discuss associated programs. You'll recall that a few minutes ago, we discussed that most individuals with BSGs have other habilitation programs that are associated with the BSG. It's important to think of these different programs as interactive, even though they are separate in terms of entering documentation. As an example, we'll be looking at a BSG with behaviors of concern that include inappropriate social interaction and physical aggression. The antecedent interventions and response procedures from the BSG interact with a habilitation program that focuses on appropriate requests for a break. The BSG also interacts with a money management habilitation program. The more familiar you are with both the BSG and any programs associated with the BSG, it is easier to see how they fit together, and then the more successful all the programs will be. For our example, we'll look at some associated programs for Blondie Bumstead. For Blondie's BSG, one of the tools we use for antecedent management or to intervene when precursors are observed is to prompt Blondie to ask for a break or to ask her if she needs to rest for a few minutes before she responds to a prompt. We also have a procedure for offering Blondie choices throughout her day so that she has opportunities to control her day. Finally, the BSG program also contains a special protocol to encourage Blondie to participate in a physical therapy program, which is highly non-preferred but very important activity for Blondie and her health. Her habilitation program, which also functions as her replacement behavior program, is that she will appropriately request a break. You can immediately see that by prompting or asking Blondie if she would like to take a break or rest briefly before responding to a prompt, we will support her in doing well with her appropriate request program. Blondie's money management program involves Blondie placing change in her pocketbook. The change is provided as reinforcement for completing the physical therapy program we referenced earlier. Breaks and choices are prompted as part of the special protocol contained in the BSG to support Blondie in completing her physical therapy program without engaging in behaviors of concern. Even though we won't go into lots of detail right now about Blondie's programs, you can see how they interact to create additional success. Next, let's take a look at how BSG documentation will be entered. For each mental health indicator or behavior that has been identified, you should first find the listing for your shift. Please note that third shift appears at the top because BSGs will be implemented at midnight. You'll see a drop-down box on the right side. If the mental health indicator or behavior did not occur at any time during the shift, select No from the drop-down box. If the behavior did occur at any time during the shift, select Yes from the drop-down box. Let's take a little bit closer look at the data entry area. Here we see the third shift data entry area for an individual with two behaviors of concern: physical aggression, or PA, and self-injurious behavior, or SIB. As we saw on the last slide, we're basically going to be answering a yes/no question for each behavior of concern. Select Yes from the drop-down box if the behavior occurred during your shift, otherwise select No. The operational definition of the behavior will also be included here as a quick reference. Below the Yes/No score drop-down box is an area for comments. This is one of the places you could use to provide information about the behavioral event, or a T-log can also be used. If you indicate that a behavior of concern has occurred, please be sure to also provide a summary of the behavior event. This summary may contain a narrative or descriptive summary, if you feel that is important for additional information. Your summary should also include an ABC summary. You'll remember the ABCs from your BSP orientation, describing A, antecedent, what happened immediately before the behavior; B, behavior, a description of the behavior itself; and C, consequence, what happened immediately after the behavior. As we said before, there are two different ways to enter this documentation. You can use the comment fields that appears under the drop-down box you use to enter yes or no, or you can write a separate T-log. As we discussed during the BSP training, it's important to remember that the behavior analyst is one of the few people who will see the information that you put into the comments box. Therefore, if you observe something like pain, injury, confusion, a new, unusual behavior, and so on, that other members of the team should be aware of, you should always document these occurrences appropriately. If you are in doubt about whether a comment or a T-log is the more appropriate choice, it would probably be better to provide the documentation with a T-log, just to be sure the appropriate people have access to that information. Before we conclude this orientation to BSGs, let's spend a quick moment looking at documentation for sleep tracking programs. Not every individual with a BSG will have a sleep tracking program. However, for some individuals for whom sleep is an important mental health indicator, a separate sleep program will be assigned. Also, in a few specific cases, sleep may be tracked for some individuals who do not have a BSG program at all. Regardless of the circumstances where you might find a sleep tracking program for a given individual with whom you work, these programs, if run through Therap, will be very similar. Most of the sleep tracking programs you will be using will be set up to document sleep for an entire 24-hour period. Depending on the individual, you may see a program that tracks sleep by hourly intervals or 30-minute intervals. Also, you will notice that the Therap sleep tracking programs start with the 2300 interval. This is a little different than what you would see with the paper BSP form, which starts at midnight. Documentation for sleep tracking programs is very straightforward. Let's take a look at the documentation area of a sleep tracking program. We'll first look at the hourly interval version. First off, you'll notice, as discussed earlier, that the program starts with the 2300 interval. Each interval for which you'll be documented is labeled separately. If the individual was asleep for the entire interval, in this case 2300 to 2400 and 2400 to 0100, that would be scored as yes. If the individual was awake for some or all of the interval, it would be scored as no. Scoring uses the same method as the BSG. You will select either yes or no from the drop-down options on the right. A comment area is also available for each interval for any notes you may want to add, including, for example, a note that the individual was briefly awake for personal care during the interval. The 30-minute interval version of the sleep program is very similar. We will start with the 2300 interval. The only difference is that there are only 30 minutes in the interval. We are still going to mark yes if the individual was asleep for the entire 30 minutes, and no if the individual was awake for any part of the 30-minute interval. The drop-down boxes are the same, and the comments field should still be available to you for any notes you may have about the interval for which you are documenting. This completes the training presentation introducing you to behavior support guidelines. You will next be completing the quiz for this training. Thank you for your attention to this orientation to BSGs. We hope this presentation has been useful in introducing you to BSGs. As you move forward in your training, the Behavior Support Specialist for your home, or ICF, will provide in-servicing for the BSPs and BSGs for the individuals with whom you will be working. Our goal, as always, is to provide the appropriate level of support in the least restrictive manner to the individuals we support. Once again, welcome to BSDC.